Staying informed in healthcare today, it feels like navigating a constantly shifting landscape, doesn't it?
It really does.
You're trying to keep up with the latest research, understand evolving treatment guidelines. It can all feel incredibly complex. Now, underneath all of that, there's this foundational system. It impacts pretty much every healthcare interaction, yet, most of us don't really think about it.
You must mean the ICD-10 coding system.
Exactly.
That's right. Think of it as the universal language of healthcare. It's really the bedrock that lets doctors and hospitals communicate what they're doing and why. And ultimately, that affects how they get reimbursed.
Right, the money side.
But it goes much further than that. It's also the basis for understanding public health trends, measuring the quality of care you receive. Every single time you interact with the healthcare system, this coding is happening kind of behind the scenes.
Right, behind the curtain. And that's why we wanted to take a deep dive today into the most recent updates to these ICD-10 codes here in the US. Now, I know, it might not sound like the most thrilling topic on the surface.
That agrees lately.
But stick with us. Understanding these changes offers a really insightful look into how healthcare information is organized and tracked. This isn't just for the medical coders out there.
No, definitely not. It has implications for anyone involved in or even just curious about healthcare in America.
So, consider this your express route, maybe, to understanding these updates without getting lost in all the technical jargon.
Yeah, our goal here is basically to extract the essential information, explain what's new, and highlight why these changes are actually pretty significant.
And to do that, we've gone straight to the source. We're looking at the information released by the very agencies that create and manage these codes.
That's the key. We're talking about the Centers for Disease Control and Prevention, the CDC, specifically their National Center for Health Statistics, NCHS,
Right.
and the Centers for Medicare and Medicaid Services, or CMS. We'll be focusing mainly on the updates for fiscal year 2025, which, started last October 1st, 2024.
Okay, FY25.
And also that interim update that just came out on April 1st of this year, 2025.
Right, the mid-year one. So our mission today is straightforward. Make these ICD-10 updates clear, understandable, and maybe even, dare I say, a little bit fascinating for you.
Let's give it a shot.
Okay, let's unpack this.
Yeah.
What exactly is ICD-10 and why should this, matter to someone listening?
Okay, so at its heart, ICD-10 stands for International Classification of Diseases, 10th revision. It's basically a standardized system used in the U.S. to classify and code both diagnoses, like what's wrong with a patient, and the medical procedures performed to treat those conditions.
Okay.
Now, what's really key to understand here is that this isn't optional.
Not optional.
Nope. It's mandated by IPAPA, the Health Insurance Portability and Accountability Act.
IPAHE.
So every entity in the healthcare system, hospitals, doctors, clinics, they're required to use it. Think of it like a universal translator for medical information.
So it's not just a suggestion. It's actually the law.
Pretty much.
And you mentioned it plays a vital role in a few key areas. Can you remind us why this coding system is so crucial?
Well, first and foremost is how healthcare providers get paid. Reimbursement.
Right, the billing.
The codes submitted on a bill tell insurance companies precisely what services were rendered and the reason, the diagnosis for those services.
Okay, number one, getting paid.
Secondly, it's essential for tracking public health. By systematically recording which diseases are diagnosed and how often, we can identify health trends, understand outbreaks, allocate public health resources effectively.
So seeing the big picture.
Exactly. And finally, it's a critical component of measuring and reporting on the quality of healthcare. Hospitals, clinics, they use these codes to assess their performance, identify areas for improvement in patient care.
So it's way more than just billing. It's population health, quality care.
Yeah.
That makes a lot of sense.
It really ties a lot together.
But why the need for regular updates then? It sounds like a monumental task to revise this entire system all the time.
That's a really insightful question. I mean, just consider the rapid pace of progress in medicine.
Yeah, it's fast.
New diseases emerge, innovative treatments are developed, our understanding of existing conditions deepens. The ICD-10 system needs to evolve right along with this progress to accurately reflect current medical knowledge, clinical practices.
So it has to stay relevant.
Precisely. These regular updates ensure that the coding system remains a relevant and precise tool for capturing the reality of healthcare delivery today.
Okay, so it's like updating a medical dictionary constantly to keep up with new terms and definitions. Now, who are the main players in this ICD-10 arena in the US? You mentioned CDC and CHS and CMS. What are their specific roles?
Right, so the oversight of ICD-10 in the U.S. primarily falls to these two federal agencies. Within the CDC, it's the National Center for Health Statistics, NCHS, that's the key entity responsible for ICD-10 CM, the clinical modification.
CM, that's the diagnoses.
Exactly, the what's wrong. Their website, cdc.gov/EDIS-10-CM, official code sets, the essential coding guidelines, it's all there. Essentially, NCHS takes the World Health Organization's international framework and adapts it for use here in the U.S.
Okay, so NCHS handles the diagnoses. What about what was done, the procedures, the treatments?
That responsibility lies with the Centers for Medicare and Medicaid Services, CMS.
CMS.
They manage ICD-10 PCS, which stands for the Procedure Coding System. This is primarily used by inpatient hospitals to code the medical procedures they perform.
Inpatient procedures, okay.
Their website, cms.gov Medicare Coding Bill ICD-10 Codes, is the crucial resource for PCS info. But interestingly, you can also find the ICD-10 CM information on the CMS site too.
Oh, really? So CMS kind of has both.
Yeah, it makes a bit of a central point of access, which is handy.
So NCHS for diagnoses, CMS for procedures, and CMS website is kind of a hub. Is there any, formal way these two agencies work together on ICD-10?
Yes, absolutely. They collaborate through the ICD-10 Coordination and Maintenance Committee. It's often just called the C&M Committee.
C&M, okay.
This committee includes experts, stakeholders from across healthcare, and it serves as a forum for discussing and considering proposed revisions and updates to both CM and PCS code sets.
So they talk it all through there?
Yeah, it's a collaborative effort to make sure the system stays accurate, consistent, and, responsive to what the healthcare community actually needs.
That makes sense.
Right.
A necessary collaboration. Okay, so let's get into the specifics now. The updates for fiscal year 2025. What changes became effective back on October 1st, 2024? Let's start with ICD-10-CM, the diagnosis codes.
Okay, ICD-10 TEDI-10. As you said, a new set of codes and revisions to existing codes were implemented starting October 1st, 2024. CMS provides a really comprehensive collection of files for this fiscal year.
What's in those files?
If you go to their website, you'll find the complete tables of codes, an alphabetical index to help you find the right code, addenda that detail all the specific changes made,
Okay.
and really importantly, the official coding guidelines for FY 2025. Think of these guidelines as the rule book for applying these codes correctly.
The rule book. Got it. So if a healthcare provider is coding a diagnosis for a service provided anytime between October 1st, 2024 and September 30th, 2025, they should be using these specific 2025 ICD-10-CM files.
Exactly right. That time frame lines up with the federal government's fiscal year, October to September.
Right.
And having this consistent timeline helps everyone, doctors, coders, software developers, helps them prepare for and implement the new code sets in a, timely and synchronized way.
Makes sense. Keeps everyone on the same page. Okay, now what about ICD-10 PCS, the procedure codes? Were there similar annual updates that also took effect on October 1st?
Yep. The ICD-10 PCS code set also had updated files that became effective October 1st, 2024 for fiscal year 2025. And these files are just as thorough as the CM ones.
Okay, what do they include?
They include an order file, the crucial official coding guidelines specific to PCS, a summary outlining all the changes and updates, the complete set of procedure codes themselves, a conversion table which can help map older codes if needed, the detailed code tables and index for searching, and any relevant addenda specifying the changes. Pretty comprehensive stuff.
Sounds like it. And these FY 2025 ICD-10 PCS files were to be used for patient discharges happening between October 1st, 2024 and March 31st, 2025. Is that right?
Precisely. So for that first half of the fiscal year, those were the standard codes for coding any inpatient procedures performed.
Okay, so that covers the big annual updates from last October. Now let's switch gears to the interim update, the one that happened more recently on April 1st, 2025. What were the changes for ICD-10-CM this time around?
Well, what's interesting to note here, for ICD-10-CM specifically, is that there were NO entirely new codes introduced on April 1st.
No new diagnosis codes at all?
Nope. The primary focus of this interim CM update was really on making revisions to existing codes and correcting any typographical errors that had been found in the current code set.
So just kind of cleaning things up, refining the existing diagnoses.
That's the key point, yeah. To reflect these adjustments, updated diagnosis code files were released. These include the code descriptions in tabular order, basically the structured list, an addendum detailing exactly what changed in the existing codes, and revised code tables and index to help users navigate the updated info.
And these newer files are for use from when?
These are for all discharges and patient encounters from April 1st, 2025, running through September 30th, 2025, so the second half of the fiscal year.
Okay. And were there any other parts of the ICD-10-CM system that stayed the same with this April 1st update?
Yes, it's worth mentioning that the 2025 Present on Admission or POA exempt codes file
POA, right?
and the 2025 conversion table were not modified as part of this interim update. They stayed the same.
Okay, what's POA again, briefly?
Oh, present on admission just refers to whether a condition was already there when the patient was admitted to the hospital. And these exempt codes are specific conditions where you don't need to report POA.
Gotcha. So those stayed stable. Good to know.
Right. Provide some stability amidst the changes.
Okay, that's clear for ICD-10-CM in April revisions, not new codes. Now, what about the ICD-10 PCS interim update that also took effect April 1st, 2025? Was it similar minor adjustments, or was there more going on there?
This is where things get particularly noteworthy. Unlike CM, the April 1st, 2025 update for ICD-10 PCS included a pretty significant development.
Oh, what was that?
The introduction of 50 entirely NUW procedure codes.
50 new procedure codes in the middle of the fiscal year. Wow, that sounds like a pretty substantial addition.
It is. It's quite significant.
What kind of, advancements might lead to creating so many new codes midstream like that?
Well, adding 50 new procedure codes mid-year really highlights the rapid innovation we're seeing in medical technology and treatment approaches.
Right, things are moving fast.
Exactly. These new codes likely reflect the emergence of novel surgical techniques, maybe new minimally invasive procedures, or perhaps new ways of delivering existing therapies. Having this level of detail allows for much more granular data capture.
And that helps down the line.
Oh, yeah. Down the line, it can significantly improve our understanding of how effective these newer interventions are, what the outcomes look like.
Okay, so for any procedures performed from April 1st, 2025 through September 30th, 2025, facilities need to be aware of and actually using these 50 new codes.
Absolutely.
What kind of updated files were released to support this big change?
Just like the annual update, CMS released updated files for ICD-10 PCS effective April 1st. You've got the order file, a version update summary that specifically lists all the new codes added.
Okay, that's helpful.
The complete codes file, which now includes these additions, conversion table, the updated code tables and index reflecting the new codes, and an addendum detailing all the changes.
So all the technical stuff is there. But you mentioned something really important about the official coding guidelines for this April 1st PCS update. What was the situation with those?
Yes, this is a crucial point to emphasize. At the time this information was made available, and this is important context, the 2025 official ICD-10 PCS coding guidelines specifically for this April 1st update were, and I quote, not yet available.
Not yet available. Wow. So new codes are rolled out, they're supposed to be used, but the official instructions on how to apply them correctly aren't actually out yet.
Precisely.
That seems, well, potentially challenging. What are the implications of that?
It really underscores the absolute necessity for healthcare professionals, coders, auditors, everyone involved to diligently and regularly monitor the CMS website for the release of these specific guidelines.
Gotta keep checking.
You have to. While the new codes are in effect and must be used, having that official guidance is paramount for ensuring accurate, consistent, compliant coding. Without those guidelines, there's a significant risk of, confusion, misinterpretation,
errors.
and ultimately incorrect coding, which can mess up reimbursement, skew data quality.
Yeah,
It's a big deal.
absolutely. That perfectly leads into the critical role these official coding guidelines play in general. Let's dig a bit deeper into where professionals can actually find these essential rules for both CM and PCS.
Okay. So for ICD-10-CM, the diagnosis side, the National Center for Health Statistics, NCHS, through their website, is the primary source for the official coding guidelines.
NCHS for CM guidelines.
Right. These are updated annually and provide the fundamental rules, conventions, instructions for picking the right diagnosis codes. However, it's also important to know that CMS also publishes its own version of the FY ICD-10-CM coding guidelines.
Oh, okay. So there are two sets for CM.
Kind of. The CMS version is intended as a companion document to the official NCHS guidelines. It often offers extra clarification, maybe examples, interpretations that can be incredibly helpful, especially in complex coding situations.
So for accurately coding diagnoses, the best practice is really to consult both the NCHS guidelines and the CMS companion guidelines to get the full picture.
That's absolutely correct. A comprehensive understanding really requires reviewing both sets to catch all the nuances and official interpretations.
Okay, check both for CM. Now, what about ICD-10 PCS, the procedure codes? Is it the same deal?
For PCS, the situation is a bit more streamlined. CMS is the primary and essentially the sole provider of the official ICD-10 PCS coding guidelines.
Just CMS for PCS guidelines.
Right. These are indispensable for accurately and compliantly coding those inpatient procedures. And as we just stressed, it's critical to remember that the April 1st, 2025 PCS guidelines, the ones covering those 50 new codes, were still pending release when this info came out.
Right, the not yet available caveat. So, key takeaway here. Always prioritize the official guidelines. For diagnoses, check NCHS and CMS. For procedures, check CMS, and definitely keep a sharp eye out for the release of those April 1st PCS guidelines.
Couldn't say it better myself.
Now, beyond just accessing the guidelines, what are some of the most important, best practices that coders should follow to make sure they're using these ICD-10 codes accurately day to day?
Okay, yeah, there are a few fundamental rules and practices that are absolutely crucial. For ICD-10-CM, a cornerstone principle is always begin your search for the right code in the alphabetical index.
Start with the alphabetical index. Why?
Well, that index lists medical terms, conditions, procedures alphabetically, and helps you narrow down the potential codes. But, and this is a step you absolutely cannot skip, you must then always verify the code you found there by looking it up in the tabular index, or tabular list.
Verifying the tabular, okay.
The tabular index provides the full, specific descriptions of each code, plus any important instructional notes like inclusions, exclusions, sequencing rules that might apply. You have to go to the highest level of specificity available in the tabular index to pick the most accurate code for the documented diagnosis.
Index first to get in the right area, then tabular list for the exact address and any special rules. Got it. Perfect analogy. What else should folks involved in coding keep top of mind?
Well, we've touched on it, but it's worth repeating because it's so vital. Strict adherence to the official coding guidelines from both NCHS and CMS is just paramount. These aren't suggestions. They're authoritative rules dictating how codes should be applied in all sorts of clinical scenarios.
Follow the rules. Check.
Another critical element is the quality and completeness of the clinical documentation in the patient's medical record. The codes you select must be fully supported by what the doctors and nurses actually wrote down.
So documentation is key. Garbage in, garbage out.
Exactly. If the documentation lacks clarity or specificity, it can easily lead to coding errors, potential compliance issues. It all starts with the documentation.
Makes sense. Anything else?
And finally, it is absolutely essential to always use the specific ICD-10 codes and the corresponding coding guidelines that were in effect on the exact date the healthcare service was provided.
The date of service matters.
Hugely. The codes, the rules, they change with these updates. So using the correct version for the specific date of service is fundamental for accurate and compliant coding.
Those all sound like really fundamental yet incredibly important practices. Now, navigating these updates, the whole ICD-10 system, it can understandably feel a bit overwhelming.
It certainly can.
What kind of educational resources are out there? Are there tools provided by these government platforms to help healthcare professionals?
Fortunately, yes. Both NCHS and CMS offer a wealth of valuable resources. NCHS provides a fantastic and free ICD-10-CM browser tool.
A browser tool. Tell me more.
Yeah, you can find it at icd10cmtool.cdc.gov. It's an online tool, super user-friendly, and it incorporates all the updates to the code set since it first started. You can easily search for specific codes, browse the index using medical terms, even filter searches by specific fiscal year updates.
Oh, that's handy for seeing changes over time.
Exactly. It's really helpful for understanding how codes have evolved.
What else does that browser tool do?
It also gives you direct, easy access to the complete official ICD-10-CM coding guidelines, the entire tabular list, the alphabetical index, other essential resources, all in one convenient place. It really streamlines finding and understanding the codes and rules.
That sounds extremely practical. Okay, that's great for ICD-10-CM from NCHS.
Hi.
What about CMS? What resources do they offer for learning about both diagnosis and procedure coding?
CMS also provides some excellent, readily accessible web-based training modules, WBTs.
Web-based training.
Yep. They have one module focused specifically on diagnosis coding using the ICD-10-CM, and another dedicated to procedure coding using the ICD-10 PCS. These are interactive modules. They offer structured learning, guide you through the complexities of both diagnosis and procedure coding within the ICD-10 framework.
And they're straight from CMS, the overseeing agency.
Exactly. So you know you're getting information directly from the source responsible for overseeing much of the application of these codes.
Very valuable.
Yeah.
Are there any other resources CMS makes available?
Yes, definitely. The Medicare Learning Network, or MLN.
MLN, I've heard of that.
Right, it's an educational arm of CMS. They offer a wide array of additional resources, training materials on various healthcare topics, including really in-depth guidance on ICD-10 coding. CMS also publishes informative fact sheets on code sets, which can give you concise overviews.
Fact sheets, good for quick reference.
Yeah. And importantly, the CMS website keeps a comprehensive archive of past ICD-10 code files and official news announcements, so you can look back, see the history, use it as a reference.
So it sounds like there's actually a significant amount of educational support available directly from the government agencies themselves. That's really good to know.
There really is. You just have to know where to look.
Okay, finally, with these updates happening annually, sometimes these interim ones pop up. What are the most effective ways for healthcare professionals to stay informed proactively? How can they avoid being caught off guard by these changes?
Yeah, staying informed definitely requires a proactive, consistent approach. That CMS ICD-10 website we keep mentioning, cms.gov, Medicare coding, billing CD-10 codes, is consistently updated. Latest code files, official guidelines, critical announcements, it's all there.
So checking the website regularly.
Yes, but even better. One of the most valuable features they offer is the ability to subscribe to email updates.
Email alerts.
Exactly.
Yeah.
By signing up, you get timely notifications about new information code updates, guideline revisions, important announcements straight to your inbox. This is arguably one of the most effective ways to stay current without having to constantly check the site.
Email alerts sound pretty essential then. What about the NCHS website? How can that help with proactive information gathering?
The NCHS ICD-10 website, cdc.gov/ICD-10 remains crucial, especially for info specific to ICD-10-CM, the diagnoses.
Right, the CMS source.
They also post important announcements, detailed updates, related materials there. It's definitely good practice to periodically visit that site too, check for any new CM-specific news or updates. While CMS is broader, NCHS is the definitive source for the development and maintenance of ICD-10-CM itself.
Okay, so the strategy is check both CMS and NCHS websites regularly, and definitely sign up for those CMS email updates. Is there anything else professionals can do to maybe get ahead of the curve?
Absolutely. Remember those ICD-10 Coordination and Maintenance Committee meetings we talked about earlier? The CNM meetings?
Yeah, where they discuss proposed changes?
Right. These are public meetings, co-chaired by NCHS and CMS reps. Information about upcoming meeting schedules, detailed agendas, all the relevant materials. It's usually available on both the NCHS and CMS websites beforehand.
So you can see what they're going to discuss.
Exactly. By either attending virtually or just reviewing the meeting minutes and materials afterwards they make, those public professionals can get valuable early insights into proposed changes. You can understand the reasoning behind them and proactively prepare your systems, your practices, for future updates.
So it's like an early warning system for what might be coming down the pipeline in coding changes.
Precisely, it gives you a heads up.
That's a really insightful tip, monitoring those C&M committee meetings. Okay, wow, we've covered a significant amount of ground today. Let's try and do a quick recap of the most important key takeaways for everyone listening.
Sounds good. Let's boil it down. First, ICD-10. Fundamental framework in U.S. healthcare, impacts reimbursement, public health, quality measurement, and it's mandated by IPA. Can't ignore it.
Bedrock system.
Second, the players. CDC and CHS is primarily responsible for ICD-10 CM diagnosis codes. CMS manages ICD-10 PCS procedure codes, mainly for inpatients.
NCHS for CM, CMS for PCS.
Got it. Third, the updates. For fiscal year 2025, both systems had annual updates effective October 1st, 2024, new codes, new guidelines.
Okay, the annual refresh.
Then, the April 1st, 2025 interim update. No new diagnosis codes for CM, just revisions, but a significant 50 new procedure codes for PCS. Big difference there.
50 new PCS codes in April.
Crucially, the official coding guidelines for those new April 1st PCS codes were still pending release at the time of the info we reviewed, so keep checking CMS for those.
Very important caveat. Guidelines pending.
Fourth, Guidelines are king. Always consult official guidelines, both NCHS and CMS for CM, primarily CMS for PCS.
Follow the official rule books.
Fifth, best practices. For CM, start with alphabetical index, always verify in the tabular index for specificity, adhere strictly to guidelines, ensure complete, precise clinical documentation, and always use the codes and guidelines effective on the date of service.
Index, then tabular, guidelines, documentation, date of service.
Stop.
Check.
Sixth, resources are available. NCHS has the free ICD-10 CM browser tool. CMS has excellent web-based training modules for both CM and PCS, plus the MLN and fact sheets.
Lots of help out there.
And finally, stay informed proactively. Regularly check both the CMS and NCHS websites. Seriously consider subscribing to those CMS email updates, and maybe monitor the schedules and materials from the ICD-10 CNM committee meetings for a heads up on future changes.
Excellent summary. Really hits all the key points. So after taking this deep dive into the latest ICD-10 updates, here's maybe a final thought for you, our listeners, to consider. Given the continuous advancements in medical knowledge, the development of new procedures, this ever-evolving landscape of healthcare delivery, how might the frequency and the nature of these ICD-10 updates continue to transform in the years ahead?
Interesting question.
And what implications might that have for the future of how we manage and analyze healthcare data on a much broader scale? Something to chew on. We definitely encourage you to explore the website links we mentioned throughout this discussion for more in-depth information, and of course to stay up to date on the latest changes. Thanks for joining us.
Thank you, viewers, for watching. If you found this video helpful, don't forget to hit that like button and share it with your colleagues. And if you haven't already, make sure to subscribe to the channel by clicking that subscribe button below so you never miss out on valuable insights. I'm Brian Edmonds, signing off. See you in the next one.